Dear viewers, welcome you all to our show, OSA, that is Orthopedic Solution Academy. Hope you all are well during this COVID-19 pandemic situation by wearing masks and keeping distance with each other. Dear viewers, today is the last program of 2021, and that was the crucial year for all of us, and hope we are getting a fantastic year of 2022. Dear viewers, today our topic is Charcot Arthropathy of Ankle and Foot by Ilizarov. And the speaker is the one and only, the legendary Ilizarov surgeon of Bangladesh, Professor Mofakarul Bari sir. I would like to request Professor Mofakarul Bari sir to join with us.
Yes, good afternoon and Happy New Year for next year. Thank you
Good
so much.
afternoon, sir. Good
Good
afternoon. Thank
afternoon.
you, sir. Dear viewers, we have two learned academic experts with us. One is the highly academician, Professor Novikov sir from Kurgan, Russia. I would like to request Professor Novikov sir to join with us. Good
Good
afternoon,
afternoon,
sir.
dear colleagues. Good afternoon.
Yeah,
I
Happy New
want to
Year, sir.
congratulate with New Year.
Thank you very much,
Happy
sir.
New Year.
Happy New Year.
Happy New Year, sir.
С
Dear
Новым
viewers,
годом!
yes, we have another learned academic expert from India, that is Dr. Shamsul Huda, sir. And I think he will be connected with us in the coming part of our program. And we have another academic expert from Iraq, that is Omar, sir. I would like to request to Omar, sir, to join with us.
Thank you so much. Happy New Year for all of you. I'm very glad to join to this activity.
You're welcome, sir. Good afternoon.
Thank you so much.
Yeah. Dear viewers, you all know that the Charcot arthropathy is a very critical thing for all the orthopedic surgeons. But we can manage it by Ilizarov. How? And that will be discussed today by our honorable speaker, Professor Mofakarul Bari sir. I would like to request Professor Mofakarul Bari sir to share his screen and start his magnificent presentation. Sir.
Okay, thank you, Tanveer. And today, my dear Omar Warabi from Kurdistan professor is a very good Ilizarov surgeon. And of course, my good friend, Professor Novikov for Kurgan Center and Shamsuluddha from India. And we are going to finish our this year 2021 program, and hopefully coming next year inshallah will be good for all of us. And with these few words, happy new year to you all. I would like to start my talk. And uh, Charcot Arthropathy of ankle and foot by Ilizarov technique, how we are treating this. This is my all slides. All the time I'm showing you the places that I have taken my training. This is my three cities I would like to show: Kurgan, Tashkent, and Kiev. This is the middle one. You can see the RIC RTO, orthopedic capital, now the winter season. And this is our National Institute, and which is in our capital, Dhaka. And this is at present I am working with the diabetic patients. That's why I've taken this topic, so that I can show you my experience, what we are doing in the diabetic hospital with the diabetic patients and of the Charcot ankle and foot. This is a crucial and very important topic for the orthopedic surgeon. This is my center where I'm doing all the time and fighting with the Ilizarov apparatus. And for am always man, meat, method, and magician. So learning Ilizarov is like learning a language. We must know the alphabets first, grammar, and to improve our vocabulary, and we shall have to use it. Nobody can teach you how to write a short story, a novel, or a poem. We must know the biomechanics of the Ilizarov ring fixator. And at the same time, when you are going to apply the Ilizarov, we must know the safe corridor. And of course,
So we are facing network problems, sir. You have hanged, sir. Sir, can you hear me, sir? Professor Bari, sir. Dear viewers, we think we have a network problem there, and hope Professor Bari, sir, will connect within a few seconds with us.
Lost you? Okay, okay. I'm coming again.
Yeah, sir, it's okay,
Yes.
sir. It's okay now, sir.
Okay. Now you can see.
Okay.
Okay. Okay. So whenever you are facing any problem, you just let me know.
Yes, sir.
So learning Ilizarov is like learning a language. Teach alphabets, grammar, improve your vocabulary, and use it. Nobody can teach you how to write a short story, a novel, or a poem. And we must know the biomechanics of the Ilizarov ring fixator, and we should have to know the safe corridor, and of course the biology. This is the very important for Ilizarov surgeons. In 1883, Jean-Martin Charcot first described the Charcot neuroarthropathy. And after that, William Rayleigh Jordan in 1936 described the relations of Charcot with diabetes mellitus. Charcot neuroarthropathy, we can put the diagnosis of this disease clinically when we can see the loss of normal food sensation. This is very important. And at the same time, the ulceration with food deformity. And what are the factors related with this? Autonomic neuropathy, osseous malignant, repetitive trauma, metabolic abnormalities you will find. And of course, this is related with the renal disease and related with the osteoporosis and glycosylation of bone proteins and collagen. There are two theories that may cause the Charcot arthropathy: neurovascular theory and the neurotraumatic theory. Sympathetic denervation initially increases the peripheral blood flow, leading to arteriovenous shunting that causes hyperemia and bone resorption. The vessels are dilated which increases peripheral blood flow. Acute or repetitive trauma may invite Charcot neuroarthropathy. Ulceration occurs in osseous prominences. What the real management of the Charcot arthropathy? Here we can talk about the debridement. We should have to go for osteotomy, and we can go for arthrodesis, and at the same time we can lengthen the tendoachilis, and open reduction and Ilizarov external fixation is a good choice for real orthopedic management of Charcot neuroarthropathy. Clinical manifestations we can see here. There are 6 locations. This is very important. At present, I am working in the diabetic hospital. Therefore, I am getting all the time the 6 locations in the ankle, tarso-metatarsal joint, that means Lisfranc joint, and metatarso-phalangeal joint. And we are getting a lot of cases affected by this Charcot in the midfoot, in the subtalar region, and of course, the very important is the calcaneal region. And we are getting a lot of cases, especially in the Lisfranc, in the calcaneum, and in the ankle. Now, dear friends, you can see here the locations of the ankle, Lisfranc naviculo-cuneiform, and at the same time,
Sir, sir, can you hear me, sir? Professor Bari, sir.
infection and talonavicular Asian holes. You can see here stage 1, 2, 3, and 0. Stage 1, developmental phase, characterized by fragmentation of bones and cartilage, joint effusions, subluxation, and dislocations. Of course, we can see the soft tissue edema, hyperemia, bone resorption, and intraarticular fractures. And in a stage 2, coalescence phase characterized by decreased soft tissue edema, healing of fractures, and organization bone fragments. And in a stage 3, reconstruction phase, which is characterized by new bone formation and remodeling of bone. Shibata et al., they have another stage classified that is called stage 0, acute phase characterized by swelling, warmth, joint instability, and normal radiographic anatomy of foot and ankle. Now, if you think about the treatment options, we should have to go for conservative treatment options. That is the wound case, total contact casting, and braces are commonly used to obtain closed tissue development of the foot and envelope of the foot and ankle. Surgical reconstruction is identified when conservative and recurrent ulceration is present. Surgical treatment options, our aim is to restore the alignment. This is very important, and the stability, and at the same time to prevent amputation. Surgical treatment, we can go for acute versus gradual correction. Deformity correction can be easily done by Ilizarov device. The first stage of reconstructing the Charcot foot is to obtain correction, and second stage to maintain the correction. So this is very important. We must obtain the correction and we must maintain the correction. Acute correction, open reduction with internal fixation was the mainstay for treatment of Charcot foot deformities earlier. Large open infections were made to remove the excess bone and to reduce the fragmented or dislocated bone. Screw fixation or plantar plating was traditionally performed in an attempt to stabilize the Charcot joint. These invasive surgical procedures typically resulted in a non-anatomic correction. Although performing open reduction has disadvantages, in cases of tarso-metatarsal Charcot deformity, it is also advantageous. Now, acute realignment achieved by performing a wedge dissection and applying the Ilizarov fixator, which produces a stable foot function. Now, I would like to talk regarding the Ilizarov fixation in Charcot. Ilizarov apparatus allows for fine-tuning of residual deformity correction outside the operating room. With internal fixation, the precise plan for deformity correction must be obtained at the time of surgery and cannot be altered during the post-operative period. This fantastic Ilizarov apparatus constructs can allow early weight bearing, which can lessen the severity of the disease osteoporosis and allow for access to the soft tissues for wound care. It is used for stabilization of an acute correction or for gradual correction of the deformity. Now, one advantage of using an Ilizarov apparatus to gradual correction, that is, the technique is minimally invasive, you know that, especially in patients with multiple previous surgeries or previous incisions. Gradual correction also allows for anatomic correction without loss of foot length or bone mass. Ilizarov fixation allows for partial weight bearing and limits neurovascular compromise because the correction occurs slowly over a period of time. Now, dear friends, regarding the frame constructs, static frame, that is for a Charcot stabilization construct, should include a distal tibial ring with a closed foot ring. This construct is generally used to treat patients with Charcot neuroarthropathy of the ankle or Charcot neuroarthropathy of the ankle combined with subtalar and a midfoot Charcot deformity. When you are treating the Charcot, we may get the complications, and these are related to the external fixation complications with the Ilizarov. Malalignment we can get the ulceration and osteomyelitis, although you are treating the ulceration and osteomyelitis and fixation failure and wound healing problems. This Ilizarov external fixation complications, patients with neuropathic conditions requires close monitoring, and we are monitoring all the time, weekly and bi-weekly, to assess the fixation failure and pin site infection. Obtaining proper anatomic alignment in axial, sagittal, and transverse plane is very critical. The severity of Charcot deformities makes it challenging to obtain accurate anatomic correction. Failure to accurately realign the foot and the ankle can lead to recurrence of the Charcot arthroneuropathy or recurrence of ulcerations. Now, I'd like to share my experiences with the Charcot arthropathy in the ankle and foot. Let us see the case. Look at this diabetic foot ulcer, bilateral sole of the foot, Lisfranc joint involvement, 45 years of male patient. You can see here, dear friends, the deformity of the foot, rocker bottom foot, and you can see the big ulcer. Now, here the Lisfranc joint is totally destroyed. You can see here the dislocation and the rocker bottom foot and ulcer in the both foot. Patient came with this situation. If you have Ilizarov in your hand, you can go for treatment of this kind of deformity in the Lisfranc joint. What I have done, you can see here, I have gone through a incision through here, debridement and alignment of the Lisfranc joint with multiple K-wires and olive wires. And at the same time, I have done the here, you can see the transverse TTT osteotomy to increase the circulation vascularity. And this is the beauty of Ilizarov. With this, you can treat this kind of ankle and foot arthroneuropathy. Now, during treatment, you can see the right side, the big ulcer is almost healed. You can see here, and left foot not yet treated that at that time. And after treatment, you can see here, this is also treatment. And by putting the olive wires, we had distracted these. And as a result, we are getting the new vessels, arterioles, venules, and nerves here for healing process of the whole limb before treatment. And this is, dear friends, you can see only after 5 months. See the deformity of the foot, rocker bottom was corrected, and ulcer is almost healed. And now the second case, 51 years old women, open wound with non-healing ulcer for the last, 6 months. Right ankle Charcot arthroneuropathy. Exposed bone, see the color of the skin, and how you can treat this kind of patient with the diabetic arthroneuropathy. Came into my place in the hospital, diabetic, then done the debridement, put the Ilizarov apparatus, and you can see sequentially, this is, granulation tissue with healing of the ulcer. And then from the lateral view, you can see we have done the arthrodesis of the ankle. This is only after 1 month follow-up. And see the after 2 months follow-up. And this is after 2 months follow-up of the X-ray. You can see arthrodesis of here and here. And this is before treatment. After 3 months, you can see from this situation to this situation. And this is the radiographic view of the patient. And this is after 5 months. You can see the dear friend and how we can help with this fantastic Ilizarov tool by helping the patient. So this is the case. Another you can see here, 55 years old man, Charcot neuroarthropathy of the Lisfranc joint. Lisfranc joint here. I would like to show you what we have done. Transverse tibial technique. Again, lengthening of this tibial part by putting the olive wires. See, patient is happy, standing with this, one ring here, and this is a long place by putting the olive wires. 1, 2, 3, 4, 5 olive wires. And you should have to go for osteotomy. And after that, you can see here, destruction of the transverse bone, and after 1 month follow-up, and this is 3 months follow-up, you can see there was a problem here, and after 3 months, you can see the Lisfranc joint here, and this is final follow-up after 3 months. And you can see here the color of the skin after 5 months, and this is before. Now you just compare this one with this one. So this is before surgery, this is the after surgery. You can see healing process here after 3 months follow-up. And another case, dear friend, in the beginning, I told you regarding the osteomyelitis of the calcaneum. Exposed calcaneum, we see the color of the skin, and it's a very bad condition, devastating condition of the foot and ankle and calcaneum. What to do? If you have Ilizarov again in your hand, you can do something. Then what I have done, you can see here, I have put the Ilizarov apparatus in the calcaneum with olivers, and again, to increase circulation, vascularity in the whole limb, I have done the osteotomy, transverse tibial technique, and pulling the with olive wires by putting one ring here and putting one ring here, connecting with the plates. So again, what we have done, you can see before treatment, this is, you can now compare, just like after 3 months, the whole calcaneum was healed and the calcaneum was united, and the area of the skin was totally healed, and discoloration of the skin is going on. This is a process. And I always tell my dear friends, Ilizarov fixator has biological principles of gradual distraction which revolutionize the management of limb deformities. We can go for any kinds of limb length discrepancy, bony and joint deformities that I showed you, soft tissue contractures, bone loss, and delayed and malignance, infections. In diabetic patients, most of the cases we are getting infections. And when we are doing the transverse distraction, we are increasing circulation, 330% circulation. Professor Gabriel Abramovich Ilizarov in 1983, 330% circulation increases. And of course, here atherosclerotic limbs, that means ischemic limbs, we can treat by this fantastic Ilizarov. When you are treating the patients, doctor-patient relationship is very important. For this is a healing part of the process. See how you should have to treat the patient. And these are all stalwarts from Kurgan Center. You can see here big man from Ilizarov Center, Professor Shevtsov, Novikov, and then how to deal with the patient. And finally, what I've shown you, I always love to show this slide because of this. What I've shown you, this is the evidence. And on the basis of science, and of course, what we have done, this is the surgical skill of the surgeon. Technology, I always tell, is very good for machines like computers and telephones, but in human body, we need to go a step further. That is called biology. All technology have to be biologically oriented, and that can be done in Ilizarov technique by Ilizarov principles and Ilizarov's philosophy. It is not always essential that a costly technique is more advantageous. And let us be the leaders in advocating biological and cost-effective technique that globe might experience, and we can do that. So this is also Charcot Arthropathy in Diabetes, my publications in American Journal. You can see here in 2015, you can see, and these are my books, international, 93 articles and 7 books. So I always convey my gratitude towards Gabriel Abramovich Ilizarov, and the man who taught us his principles and philosophy. With these, I would like to conclude. Before that, I must say, the Ilizarov, we can feel any defect in the life of bone. When nothing can be done by Ilizarov, we can do a lot of things. And the end of disability with the diabetic patient, we can help the diabetic patients also. and bright future in disability by Ilizarov technique. We can do that. Thank you very much for your kind attention.
Thank you very much, sir, for your exceptional and excellent presentation. As because of we all know that the Charcot arthropathy of ankle and foot is like a graveyard to an orthopedic surgeon. But we can overcome this disease by Ilizarov, and that is proven by Professor Mofakkarul Bari, sir. Now, I would like to request Professor Novikov, sir, to share his knowledge regarding the presentation of Professor Mofakkarul Bari, sir. Professor Novikov, sir.
Bari, thank you very much for your life, for your job, for your message for young doctor, because just now you show excellent result with difficult area in our job, and very interesting how with the metal we can help with traffic problem. And just now coming another time when you're absolutely right, coming philosophy. If we have understanding natural process in our tissue, not only in the bone, because traumatologists, orthopedists, this is bone doctor, but you support patient with deep, heavy problem, soft tissue, arthropathy, vessels, and Ilizarov effect just now start new, I think, epoch when so many doctors in the world will understand clear natural process. Just now you show so many X-rays with funny osteotomy. What is it? Dislocation of the bone. Some doctor will understand. This is a magic kick for natural process in the all of tissue near the ulcer, near the wound, near the poor talus or calcaneus. And I want to repeat again, Bari, your country is very happy because doctor like you show the way for many doctors how we can help. This is a very deep problem, not only orthopedics problem. Thank you, because just now you open new page for doctor all of the world. Thank you.
Thank you very much, sir. Thank you very much. Now, I would like to request Dr. Omar, sir, to say something regarding the presentation of Professor Mofakkarul Bari, sir.
Yeah, can I tell who is Omar? He is my very good friend, Professor Omar, well-known Ilizarov surgeon from Kurdistan, and since long I know him. He is my very good friend, and we are always, exchanging views of different difficult cases. He's doing all the time. That's why last time I told him we are talking every week. I told him you can join, and he gladly accepted that one. He was in Kurgan also several times. So Omar Varabi, just young gentleman from India, and Professor Novikov, you know him, very good. Now you can exchange your views, and next time if you wish, you can talk with you can join in our this orthopedic academy.
Absolutely, sir.
Long time we are working this. Okay, thank you.
Sir, Professor Omar, sir, please.
Please unmute, sir.
Sir, please.
Can you hear me?
Yes, yes.
Yes, okay. I totally agree with your kind conclusion. But I have two things. One of them is that I have good number of the cases with spina bifida causing Charcot joint. I treated them in the same way which you are doing. but without any sort of elongation, without any sort of osteotomy. What about osteotomy which you are doing? Are you still preserving the length of the limb, or you are doing some sort like accordion procedure? That's my comment.
I am just widening the bone, just to increase circulation. TTT, tibial transverse technique. If you go for 10 days or 12 days, then you can increase circulation, increase. As a result, your healing process of the ulcer, will minimize.
Yes.
And the discoloration of the skin.
So you are keeping this destruction gap, so the limb will be a little bit longer than the other side. Are you like this, or you are
widening?
Widening, and you are thin. You mean accordion procedure? By Catagni, this is known as accordion procedure, as you know.
No, this is not that. This is only widening of the bone.
Yes, just widening. For 1 centimeter, you mean? 1 centimeter, or how long?
You can go for 10 millimeter, 1 centimeter, or 10 days, or 12 days, or 15 days, depending upon your case.
Yes. Thank you so much. Thank you so much for your kind invitation also. Thank you.
Thank you very much, sir. Sir, you have told that you are not doing the TTT. Without doing the TTT, how you can manage this Charcot arthropathy? If you want, you can present that thing in our Orthopedic Solution Academy also. And I think that will be a great thing.
I am correcting the deformities. So the pressure area will be changed to the normal pressure area. It means shifted to the heel and to the head of the first and fifth metatarsals. So gradually I am correcting the deformity. So biomechanically, as you know, the heel and the head of the first and fifth metatarsal can tolerate good weight bearing. That is my principle. In addition to that, daily dressing by normal saline. So we are keeping in proper anatomical alignment. We are correcting the deformity, and the ulcer will be healed. Thank you so much.
Okay, sir. Okay, that's great. That's great. Now, I would like to request Dr. Shamsul Huda, sir, to say something. We all know that we name this TTT as BTT, that is Bari's tibial transverse technique. Please share your experience regarding the. Yes, sir. Thank you, sir. Thank you. Please share your experience, Dr. Shamsul Huda, sir, please.
Thank you, Dr. Tanveer. Sir has demonstrated a wonderful technique. We have been learning from him. And in Charcot arthropathy, without Ilizarov, it's very difficult to heal. Even after multiple surgeries or braces, it's almost impossible to heal. But as demonstrated by Sir, it can be magically treated with the help of Ilizarov. You can do all the different treatments with this. So I've been done just a few cases following Bari sirs and got excellent results. Yeah, thank you, sir.
Thank you, Shamsul, sir. And that is the inspiration. That is why he is the legendary Ilizarov surgeon, not only in Bangladesh but also in the world.
I am very simple man.
Yes, sir.
Very simple
we
man.
Have to.
Legends are sitting. Legends are sitting behind. Umar Barabi, Novikov, they are Huda. They're all. I'm a very simple man. I just try to do, and really, this is Ilizarov principle. Slow and steady. I always repeat all the time. Slow and steady traction on a living tissue creates a stress which is metabolically activated. In biosynthetic and proliferative pathways, depending upon the vascularity and the functional use. If you have little vascularity, you can increase vascularity. And if you functionally use biosynthetic and proliferative, this is the principle. You must keep it in your mind. And that gives you a lot of things. And Shamsul Huda rightly told, you believe me, I am working in the diabetic, this is the very big diabetic hospital in Southeast Asia. Very big. And lots of people suffering with diabetic, everybody is cutting, amputation.
Amputation, sir, most of it.
When you have Ilizarov, you can increase circulation, no need to. Now I am doing that. And patients are happy. I am getting very much satisfaction by using this. That I showed you on the basis of science, on the basis of, this is evidence that I've shown you. This is the beauty of Ilizarov. And you can do that easily.
Yes.
Thank you.
Definitely, sir. Definitely, we will follow your instruction, and definitely our young fellows will follow your BTT technique. Dear viewers, I would like to end up this session today, and with this program, we are going to end up the 2021 programs, and hope we'll come with another great Elizarov topic in the coming 2022. And I hope you will get a fantastic COVID-free 2022. And that is our expectation and prayer to our Almighty Allah subhanahu wa ta'ala. And I would like to say bye bye to all of our legendary academic expert and our honorable viewers, and hope we'll connect in the coming Friday with another magical Elizarov topic. Till then, I'm Dr. Mohammad Tanvir Ashraf saying bye bye to all of you. Bye bye.
Thank you very much. 2002.
Happy New Year.
Happy New Year.
With
Happy New Year to all
Butilka.
of you. Happy New Year. Happy New Year.
You are watching Raj TV, Jagorone, Bangladesh. Please subscribe our channel.